When Melinda and I started our work in global health, a key advisor was Dr. William Foege. Bill is a giant in the field of public health. Bill played a pivotal role in eradicating smallpox. He went on to serve as the director of the CDC, and he pulled together the Task Force on Child Survival. Bill and I met recently to discuss our work together, polio, and how global health has changed over the years. It's been a period of great success in global health.
In 17 years, what has happened is we have gone from global health being totally a backwater study to a new vision, global health actually being funded.
The partnership between you and our foundation was fantastic. Starting in the year 2000, we had money to spend, but we were so naive about what global health was. And you came with your wisdom, your experience, and it was the start of a kind of a perfect relationship, including letting me read all these books and try to understand what was possible. I'll pick a malaria book. I had no idea about the role of disease in history and how awful it is to have something like this. I mean, it shaped the world, it shaped Africa, and we once had the question we put out to people, what's the most dangerous animal in the world? And if you define it the right way, then the mosquito wins. And hopefully, someday nobody will have to know about malaria. The smallpox eradication, it was to this day the greatest, health achievement ever. And people fortunately have come and asked for your advice ever since that succeeded.
When people say smallpox eradication was easy, you know they didn't work at it. Smallpox was such a devastating disease, and in the 20th century, WHO estimates 300 million people died of smallpox. When I first saw cases in India, what struck me was how miserable people were and how even the staff at the infectious disease hospital did not want to interact with them. You could smell smallpox before you entered the room, and it smelled like death. It's about as miserable a disease as you can imagine.
Yeah, thank God for smallpox and its success. I'm pretty sure we wouldn't have undertaken polio without that example.
Yeah. I remember telling students that no one is going to donate money for global health. And so don't expect rich people to get interested. You didn't have routes to get into global health. Anyone that wanted to get in it had to discover their own way. And suddenly that all changed, and even global health research changed, where people could not have seen getting money for global health research. It turned out to be the most popular subject in school after school.
But that should continue. We've got science on our side, we've got morality on our side, and all those people who got involved these last 15 or 20 years, hopefully they'll be inspiring and teaching the next generation like you did us.